your diary. Becoming a mother is one of the most exciting time in a woman's life. What all she should know before, during and after pregnancy? Let's find out. And to help us, we have Dr. Aby Koshi with us. He is an infertility specialist at Sunrise Hospital, Kochi. Hi doctor.
Hello.
Welcome to our show. We all know motherhood is greatest and hardest thing. So when a couple is planning to have a child, so what are the points they have to keep it in their mind?
Well, pregnancy is something can be very good news for some people and can be terrifying news for a different person also. So it all depends on the scenario behind the pregnancy. But what is important is anything in life which is planned generally gives a good outcome. So the same with the pregnancy. So if you're planning for a pregnancy, it's best to make sure that you're healthy. That means if you do have any medical problems, get them sorted out before you attempt a pregnancy. Or if you do have a doubt, there's no harm going for a health checkup before the pregnancy. Certain things also ensure that you have a good pregnancy. One, making sure that you're in the right body weight. If you smoke or use too much alcohol, if they are kept in control, that's good for your baby. And if you are taking vitamins, especially something called as folic acid, it might help you have a very good pregnancy.
So doctor, our young girls have got few doubts. Let's go to that.
Hi ma'am, I am Harita from Dublin Healthcare. Could you explain what is the best age to get pregnant?
Well, age is something which is getting more and more important now, especially when we are studying more, waiting for a longer period to start work, family and children. So in that order. So it's very important that you conceive. That means you should become pregnant when it's the best age for you. And for a woman, the best age is in her 20s. So if you're postponing a pregnancy to your 30s or even later, the chances of you becoming pregnant comes down, as well as the chances of you having a problem with either the pregnancy or the baby increases. So it's best to have
the age
that's right. As you get older, your problems increase.
Okay. So we'll move on to the next question, doctor.
Hello ma'am, I am Varsha, working at Dublin Healthcare. Could you explain what are the methods to avoid pregnancy?
Well, that's a question which is actually the reverse of what you asked me earlier. What are the methods to avoid a pregnancy? Well, it depends on how long you would like to avoid a pregnancy for. If you have any children, do you have any medical problems in your background, or is it something which is for a very short period? So if you have infrequent intercourse, or if your partner or husband is not around most of the time, something like a condom is very more convenient because it is user dependent. That means you would use it only when needed. Whereas if you are in a steady relationship, probably the oral contraceptive pill, that's the pregnancy pills which you take on a regular basis, would be the most useful and safe. If you have had children and you would like to avoid pregnancy for a fairly long time, say around 3 to 5 years, maybe something called as a copper T, which is a coil which is put inside the uterus or the womb, would be the most practical option.
And it's the intrauterine devices.
That's correct. And it's always good to get a consultation with a gynecologist or a doctor to find out what is the best method suited for you. So it's a short visit, and most of these things can be finalized in one visit itself.
Okay. So I think doctor, you have talked about the contraceptive pills, the oral pills. So is there any side effects of using that?
Well, you are probably not the first person asking me that question. Nearly everybody who comes to me asks me, doctor, does this cause any problems? But maybe I would probably answer them, look, if I had to give my wife a contraceptive method, I'd probably give the contraceptive pill, because the chances of it causing problems is very, very less, and it's very, very effective. And in fact, more than 100 million people all over the world have used the contraceptive pill without major problems. Yes, some people do have minor problems, but most of them are not of a severe nature, and in all likelihood a doctor can predict a problem based on your medical risk factors and whether a pill is suited for you or not. Moreover, you have different types of contraceptive pills, so it's something which is not just for the same population everywhere. So a certain person, say if you have had a child, you might get a different contraceptive pill. If you're older, you might get a different one. So there are different preparations which are there.
Okay, so it all depends on your health problems and the circumstances.
That's correct.
Okay. So we'll see what's the next question.
Hi ma'am, I'm Sonia. I'm from Dublin Healthcare. Well, I would like to know one thing. What's that if a woman having sex for the first time, is there any chances for getting pregnant?
Well, that's a very common myth that if you're having sex for the first time, the chances of you becoming pregnant is very, very less. But the fact remains that your chances of becoming pregnant depends on a lot of factors. And the most important thing is in which part of your cycle, that means the time after your period, you're having intercourse. So you could be really lucky if you're having pregnancy for the first time when you're having sex. But there are other people who actually might try for a long time and still not have it. So it's purely, and just by saying that it's for the first time is not going to either increase or decrease your chances of falling pregnant.
But does the age affect this pregnancy rate again?
Yeah, as I said earlier, the older you get, the chances of you falling pregnant are less and less. But then again, you might be 35 and probably having sex for the first time, but you might still get pregnant. So there's no absolutes to these things, and a lot of factors are dependent.
Dr. We'll move on to the next question.
Hi ma'am, I am Vidya from Dublin Healthcare. Is there any advantage of using any particular method to avoid pregnancy?
Well, I'll come to the biggest advantage of using a method for contraception. I suppose it's peace of mind. You're more comfortable. But then there are certain advantages which each method has. Now, if you are having sex with somebody whom you're not very sure of, maybe a condom is very useful because that will prevent sexually transmitted infections. Even pills have been made to sort of help certain people. So you have contraceptive pills which can be given to breastfeeding mothers because a regular contraceptive pill might reduce the chances of her successfully feeding the baby. So you have tailor-made pills for certain people. We have pills meant for people who have other problems like, say, excessive acne, that's pimples on your face, oily skin, excessive facial hair. So you have each pill which is different, and each one is tailored for certain groups. And when you're looking at IUDs, that's your intrauterine devices. You have devices for people who have light periods, you have devices for people who have heavy periods, there are devices for people who have more pain during periods. So there are a lot of options which are actually available. And if you are seeing the right person, they might actually go into these problems which you have and find out what is the best option. So you've got, it's like a big cafeteria where you have a lot of options.
Okay. So can you just tell me more about IUDs or intrauterine devices?
Well, intrauterine devices are synthetic implants which actually are kept inside the woman's uterus. Now generally this is for somebody who already has had a child because it's much easier to place it there. The most common one is what everybody knows as copper T, which contains a small amount of copper and it's T in shape, so that's why it's called as a copper T, and it's been there for a very, very long period. Most of the copper Ts which are available work for between 3 and 10 years depending on what make it is of.
That means once it is inserted, you don't have to remove it for another.
That's correct. So it's like once you put it, you just forget it. So maybe only when you need a change, say after 3 years or 10 years.
Or when you're planning for a child or something?
Yeah, that's fine. If you have one child, put a copper T. Whenever you want a second child, just remove it. So you are at peace till then and you don't have to worry about that.
Just forget about that.
And especially about people who keep on forgetting taking their pills. A copper T is a boon that way.
Does it have any side effects?
Well, everybody thinks that copper T is a very dangerous thing because you hear a lot of people with painful periods and more bleeding during periods. No, but that's a very small fraction, and these are the people who actually come out and talk about it. Whereas most people who are happy about it, well, you won't expect a woman who has had a copper T and she's comfortable with it to go and talk around and say, look, I've got a copper T. So that's a problem. It's negative publicity which creates a lot of problems. And those people which do have problems also, most of them, the problems do settle down in 2 or 3 months' time. So if you are patient enough, maybe that's something which will be very useful for you.
Doctor, another question here. Are there any male contraceptive methods?
Well, the condom is the most commonly used male contraceptive method, but again it's something which is user dependent. That means you have to use it properly and use it at the right time. There's a lot of research which is happening to find out something like a copper T which might work for 4 or 5 years for the man. But unfortunately there's nothing right now in the market which I can discuss, but there are a lot of things in the pipeline.
Okay. What are the permanent we say like contraceptive methods?
Well, if you have decided that you don't have want any other children, or you're not planning to remarry, then the best option is to go for either the male option, which is called as a vasectomy, where it's like called the snip somewhere, and where you actually cut the duct which actually let the sperms go outside, or in the woman where it's called a tubectomy, where a part of the tube, that's a fallopian tube, which is the tube which actually lets the egg meet the sperm, and that part is cut off. Again, these are both a surgical method. That means you have to have an operation to get this done, and it's a permanent method. That means you should be very, very sure that you don't want any more children.
Okay. So we move on to the next question, Doctor.
Hi ma'am, I'm Demya from Dublin Healthcare. Could you be explain, can we avoid pregnancy by using safe period?
Right. The concept of a safe period is something which many people know about, because even though a woman has a period once every month, that means if you have a period now and you're expecting say 30 days from now, we know that there's only a short period in between these 30 days where a woman has a very good chance of achieving a pregnancy, and the egg which is released from the ovary stays in the body for around 2 days. So that's a time when she has a good chance at achieving a pregnancy. But if a woman has slightly irregular periods, the chances of you trying to pinpoint that period where there's a chance of pregnancy and avoiding it altogether becomes a problem. Another problem which confounds the whole issue is that the sperm stays much longer in the body. It can stay for anywhere up to 5 days inside the woman's body. So you might actually have had intercourse 5 days before ovulation, but still fall pregnant. So you have to have very regular cycles. You have to have a very clear idea about when you are going to ovulate, and you should have the ability to say no when you are actually ovulating, which sometimes gets difficult. So in general, people who try to practice the safe method or the safe period method have a chance of not falling pregnant 80% of the time, but it also means that it doesn't work in 20% of cases, which is a very high failure rate. Considering that, say, the oral contraceptive pill, the chances of it failing is something like 1 in 1000 to 1 in 10,000, so that's very, very low, 0.1% compared to 20%. So that's why most doctors would not recommend a safe period method, though it's still better than doing nothing.
Okay, that means it's a little risky method.
That's true.
Doctor, we have got a mail. Hi doctor, I'm from Kottayam. I have heard about iPill. How effective is the iPill, and are there any side effects?
Well, so far we have been talking about the methods to prevent a pregnancy, and we all know that it's not a very perfect world and mistakes do happen. So it's always good to know about what methods we can use to actually correct this mistake. Now, an unplanned sexual intercourse can happen anytime, and if you know that there is a possibility of pregnancy, or maybe say a different scenario that you were using a contraceptive like the condom, but probably it's not worked properly, and you would like to have a second method to prevent a pregnancy, there should be something which you could use. Now, in iPill, or it's one of those brands of emergency contraceptive tablets which is available in the market. Now, unlike other medications which need a prescription, this is a prescription-free medication. That means anybody can go to a pharmacist and actually ask for a medicine without a prescription from the doctor. Because we know that by the time you realize that there is a problem, you go and see a doctor and then get a medicine, it might be too late. Especially with iPill, where the medicine works best when you are actually taking it as soon as the event has happened. That means you take it between, say, now and the next one day, it works very well. And the longer you wait after that, the chances of it working becomes less and less. But still, if you take it, say, up to 72 hours, that's 3 days after the event, you still have an 80% chance of it being effective. So it works quite well in most cases. So it's still better than having no method. But if you've crossed the 3-day period, that means you have crossed 72 hours, it might be a good option to go and see a doctor, because they could actually give you other methods which are not as easily available as this one, which might work. For example, a woman can have a copper tip put in up to 5 days after a sexual intercourse, which might actually prevent a pregnancy. Now, you also asked me about side effects. That's something which you have been asking very frequently. Now, the iPill or the emergency contraceptive pill works by preventing ovulation, that is the release of the egg from the ovary, or by making the lining inside the womb unsuitable for a pregnancy to implant. That means a pregnancy doesn't hold on after that. Now when this happens, it might actually sort of damage the rhythm in your body, and you might actually have a period which might be slightly later than the usual, or maybe a period which might be slightly irregular. And you know that if you have a delayed period, you would be always worried about a pregnancy, so which actually can cause a bit of anxiety. But nothing major, it won't cause a major medical problem. It's just those minor things which can actually worry you a bit more.
But I have the question here, Doctor. As soon as you take the eye pill, will it lead to a bleeding tendency?
Well, it's very difficult to predict. It depends on when you're actually taking it. So if you're very close to your period, you might actually have a period immediately after that. Whereas if you're in mid-cycle, nothing might happen. You might just have a regular normal period, a period which is delayed by a few days, something of that sort.
Do they have to get a checkup after that?
Well, a woman can find out whether she's pregnant in a very simple method. It's quite as simple as taking this tablet, is by doing a urine pregnancy test. Now that is what each person does when they want to find out whether you're pregnant or not. Now the urine pregnancy test is a single-use disposable kit which is available in all pharmacies. So you go to a medical shop, ask for a pregnancy test, and you can get one of those. The instructions are very clearly given with each kit, and it uses a urine sample. It gives you a slightly more accurate result if you use a first morning sample, and that tells you whether you're actually pregnant or not. As long as the test shows negative, you can be very sure that the pregnancy is negative. If it turns out positive, that means when you get 2 lines on the kit, it tells you that you're pregnant.
Okay. Sometimes I heard people telling that there is a mild, second line has become very faint.
Yeah. Well, the most important thing is you just have to say whether there is 1 line or 2 lines. Whether it's faint or dark is something which is not very important.
Okay.
So if you see 2 lines, you know that you are pregnant. If you see 1 line, it's not pregnant. Whether it's a good pregnancy, it's a healthy pregnancy, or what stage the pregnancy is something which you should not decide based on your pregnancy test. It is just to tell you whether you're pregnant or not. And only a further evaluation by your doctor or by a scan can you actually predict how good the pregnancy is or how many pregnancies you have.
Doctor, you have talked about eye pill. And you said taking after 3 days of sex intercourse, the failure rate is more.
That's right. It's recommended only for up to 3 days.
Okay.
It's best.
By chance, if she found to be pregnant after that, after taking an eye pill, if she finds that she is pregnant, so how does it affect the baby?
Well, if you are pregnant and you have changed your mind about whether you want the pregnancy or not, well, if you want the pregnancy, it doesn't really make much of a difference, because the eye pill just contains a hormone called progesterone, which is something which your body also produces. So it will not affect the baby or maybe make your baby more abnormal than, say, if you had conceived normally. But if you don't want your pregnancy, then you actually need to think about all the options which are there. And there are many options if you don't want a pregnancy. The most important thing is you should be very sure about what you want. I mean, being not clear about whether your pregnancy is needed or unneeded is something which you need to decide. And it's best that you decide it along with your partner about what the needs are and how you would like to tackle it. If you do want to continue with the pregnancy, which is probably the best option because it's finally good news, is to see a doctor as early as possible so that he or she can actually start the proper care which a woman needs during her pregnancy and manage it appropriately. Whereas if you are sure that the circumstances are such that you cannot continue with the pregnancy, there are methods which could be either medical, that means you can have tablets, or surgical, where a procedure is performed under anesthesia to make sure that the pregnancy doesn't continue. And all these would depend on your medical background, any problems you have, and also the most important thing being how advanced the pregnancy is. It's much safer and more effective to go for a termination in which the pregnancy is quite early, whereas it becomes progressively more difficult if your pregnancy gets advanced.
So till what period women can take tablets to abort the child?
Well, if you are just taking a medical method, that means just tablets for getting a pregnancy terminated, it can be done say up to 7 weeks. 7 weeks means from the date of your period for 7 weeks. And after that, most people would go for either a medical method, knowing that the chances of failure are slightly higher, or maybe a combination of a medical and a surgical method. If the pregnancy is quite advanced, say if it's a pregnancy which has crossed the 3rd month and up to the 5th month, the procedure can be done only like something like a mini labor, where you actually give medicines for the woman to actually expel the pregnancy. And these should be done only at certified centers which have the extra price to perform a termination like this. In India, termination is illegal after the 5th month. That means after you cross 20 weeks of pregnancy, you cannot have an abortion done in India.
So doctor, you have explained very well about pregnancy and the contraceptive methods. It was really useful. Thank you so much, doctor.
You're welcome.
Hey girls, so you must have understood how important it is to be mentally and physically prepared before getting pregnant, because every child is a gift of God. So if you have any doubts, write to us. Our email ID is youthdiaryroseball@gmail.com. So see you next week. Bye.